So welcome to your lecture on Introduction to Community Pharmacy. So in this lecture we're going to look at have an overview of community pharmacy, and as part of the lecture we're going to discuss the regulatory framework which governs the ownership and running of a community pharmacy. We'll then go on to look at the structure and function of a community pharmacy and the contractual network, or framework should I say, that kind of binds all community pharmacies. And then we'll extend the lecture to look at the journey of a prescription through a community pharmacy and discuss, what is the future of community pharmacy. So I guess if we think and strip it back to the basics, like what do community pharmacists do? So traditionally, a lot of people assume that a community pharmacist is someone who stood in a white lab coat and they just stand at the back of the shop behind a counter and they're counting pills. Okay, so they're really good at counting. They can get all their tablets together. But yes, part of the role and remit is to prepare medication for patients, and as part of the role you are dispensing medication. A lot of people kind of dumb the job down and say, all we do is give out plasters or sell sandwiches. So those of you that may or might have worked in Boots, I have been a Boots pharmacist, and yes, I do put through meal deals and 3 for 2 and all that sort of stuff, but it's part of my role. And yes, some pharmacies do sell perfumes, and they have their own little photo developing counters and stuff, but is that all that community pharmacists do? So in essence, a community pharmacist is responsible for all aspects of any medication storage or supply. So they take full responsibility for everything that is present within that within the premises of a community pharmacy. They obviously take leadership and provide information, and it can be advice and guidance to patients for the sale of over-the-counter medications, okay? And that's to the general public. It could be advice to healthcare assistants or counter assistants. They obviously have a massive role in carrying out clinical scrutiny and clinical assessment of prescriptions, and oversee the safe dispensing processes which take place as part of dispensing medication. Now, once that medication has been dispensed, as part of the role, a community pharmacist will be perfectly placed, I guess, to counsel patients on effective medication use. So making sure that the patient gets the best outcomes from their treatment. Now, some community pharmacists have extended their role, their clinical role, and they've started working in GP practices. And in that remit, they're perfectly placed to provide advice and guidance to ensure that there's appropriate prescribing of medications. So they have a variety of roles, and obviously, as you become an advanced clinical sort of practitioner, you can offer advanced clinical consultations, and after further training, you can even become a prescribing pharmacist. So there's a lot of scope for a community pharmacist. But I guess a lot of people kind of get confused about the title and the name of the place as well. So when we're thinking about the title pharmacy, okay, that is normally used and reserved, can only be used for the naming of a registered pharmacy or a pharmaceutical department, okay? Now what that means is that a pharmacy is a registered place and a restricted title, and so you can't just have anyone opening up a shop and calling it a pharmacy. It has to be a registered pharmacy practice for it to be called a pharmacy. Who can own a pharmacy? Well, a pharmacist can open a pharmacy as long as they go through all the right procedures. So myself as a pharmacist, okay, I could open up a pharmacy, and that's fine. You could also have a pharmacy which is owned by a body corporate. Okay, so there is a superintendent pharmacist who takes ownership for all of the other pharmacies. So Boots is a great example where they have one superintendent pharmacist who's almost named as looking after all of the shops, and they fall under that remit. Okay. Now, the different types of community pharmacies. So you obviously have your large multiples. A great example of that is Boots. You have your smaller multiples. So Day Lewis is a great example of this. You then have your supermarket-based pharmacies. So Tesco, Sainsbury's, even Morrison's, have their own pharmacies. Then you have your independents. So you will have had experience through your going to see some pharmacies, and you'll have some virtual tours of independent pharmacies. So Oxford Road Pharmacy is an independent standalone pharmacy by itself. And then you can also end up with what's called hospital-based pharmacy. So you actually have a community pharmacy which is based inside a hospital. And so there is a Lloyd's inside the Royal Berkshire Hospital. Now, in terms of standards, so the GPHC have standards, and they're designed to strengthen and regulate pharmacies, a bit like the standards for pharmacy professionals, which look after and dictate how pharmacists should behave and act, okay, which applies to all students and registered pharmacists. The standards for community pharmacy are there for the premises themselves, and they help to improve the quality of the pharmacy practice. They're there to promote the safe and effective environment. So what they're there to do is to make sure that the environment is safe for the patient, it's safe for the delivery of the services that the pharmacy is conducting. And those standards are laid out sort of under 5 principles. So you have principle 1, identifying and managing risks in your pharmacy. You have principle 2, which is staffing issues. Principle 3, pharmacy premises. Principle 4, delivery of pharmacy services. And then principle 5, equipment and facilities. And I will provide links to these principles so that you can, away from this screencast, make yourselves familiar with those 5 principles. Okay. Now, in terms of the contractual framework for pharmacy, so in the NHS, for the NHS in England, there are 3 tiers. Okay, so there's essential services, which you're kind of doing this term on this year. You have advanced services, which you come across in part 2, and then you have enhanced services, which you have in part 3. So essential services are all services which a community pharmacy must provide. So as part of the pharmacy contract, they must provide these services. And those services are dispensing of medication, repeat dispensing. So that is where a patient will bring in a batch of prescriptions, and the prescriber has signed the top copy and has given, I don't know, might have given 5 more authorizing prescription forms, which the patient can then come and collect, monthly or by, every 2 months, etc. But that's a repeat dispense. The community pharmacy also has to provide the disposal of unwanted medicines. So, patients should be able to walk into the community pharmacy and dispose of their medication. As part of the community pharmacy contract, we have to promote or engage in the promotion of healthy lifestyle, and that's through public health campaigns, and we should be able to signpost patients to other healthcare providers. So that could be dentists and chiropodists, it could be to family planning clinics, however you see fit. We need to ensure that we provide support for self-care, and that we have a massive focus and a strong focus on clinical governance. Now, the Pharmaceutical Services Negotiating Committee promotes and supports the interests of all NHS community pharmacies in England, and their goal is to ensure and develop the NHS community pharmacy service. So it enables community pharmacies to offer an increased range of fully funded services that meet the local communities. They liaise with the Department of Health, okay, and they negotiate terms so that we can provide community pharmacy services. So they will go and essentially barter for money from the Department of Health to ensure that pharmacy has funding to provide care for communities, for services, for any other treatment options that they want to kind of introduce as part of their kind of profile, I guess. And it's the PSNC that will go to the Department of Health and get the provision for this. So I guess what I want to do is to think about Mr. Jones, okay? So Mr. Jones comes into your pharmacy and he has a prescription which he wants to have filled. Mr. Jones notices a sign and it says that the responsible pharmacist is David Williams. So what is this? What is responsible? What is a responsible pharmacist? So I guess a responsible pharmacist, I always, when I'm working, I always have someone come in who will say, oh, if you're the responsible pharmacist, who's the irresponsible pharmacist? But I guess what we're looking at is we're trying to determine is whether there is a need for a responsible pharmacist. So the Medicines Act dictates that a responsible pharmacist ensures the safe and effective running of the registered pharmacy business. And only one pharmacist can be the responsible pharmacist at any time. So this came into play in 2006. In order to so what the law states is in order to lawfully conduct a retail pharmacy business, a registered pharmacist, so remember it can't be a pre-registration graduate or a summer placement student, it has to be a registered pharmacist, must be in charge of the pharmacy, and they must act as the responsible pharmacist. When they do so, they establish and maintain and review pharmacy procedures which set out how activities are carried out in the pharmacy, and these are essentially the standard operating procedures. Now, the level of activities which can take place in the pharmacy will depend upon the level of supervision and whether the responsible pharmacist is absent or present. So, for example, if a pharmacist steps away from the pharmacy and leaves the pharmacy, they are essentially absent. However, if the pharmacist is in the back of the pharmacy and the front counter is unmanned, okay, i.e. he's not on the front, or he or she is not on the front counter, in theory, they are not supervising that front counter. However, they are still present in the pharmacy and can be called upon and therefore supervise the transactions or the conversations that are going on. So it completely depends on the level of supervision and whether the responsible pharmacist is present or absent. So let's have a look at the responsible pharmacist notice. Now, a responsible pharmacist notice must be displayed in the registered pharmacy. It's a legal requirement. Now, the notice itself allows patients and the public to identify who is responsible for the safe and effective running of the pharmacy. Now, there are a couple of particulars which are legal. So what that means is you don't have to print the fancy General Pharmaceutical Council form. You could do this on the back of a piece of A4 paper. However, the bits that are indicated as legal must be present as part of your makeshift notice. Okay, so you need to have a statement which says the responsible pharmacist is, then the name, and it has to be the name that is registered with the General Pharmaceutical Council. You must then display your actual registration number, and then the legal bit is also at this time the above named person is the pharmacist in charge of this pharmacy. So those are all of the legal parameters that must be present as part of your responsible pharmacist notice. Now, as well as the notice, the responsible pharmacist also has to complete a responsible pharmacist record. Now, the RP record is a legal document. The purpose of it is that it shows and provides an audit trail of who the responsible pharmacist was on any given date and time, but also it provides an audit in terms of if there are any incidents or any errors, it shows who was accountable, who was present at the time. Now, this is very useful when situations arise. So you might have a serious dispensing error, there might be something that happens within your pharmacy, and actually we need to know who was in charge of the premises when such an event occurred. So this is a makeshift responsible pharmacist record. Okay, now in terms of what happens on these records is you will have a bit where you would need to demonstrate today's date. Okay, so you'd enter the date that you commenced your responsible pharmacist duties. You would then put in your full name. You then put in your registration number, and then the time that you commence your responsible pharmacist duties. And remember, it's the time that you actually start, not when you were meant to start. And then you have these other sections which you leave blank unless you're leaving the pharmacy or you cease your position as responsible pharmacist. Okay, and we'll do a couple of activities as part of this record. So obviously, if I needed to leave the pharmacy because I need to go and speak to someone, then there is a section in there where I can actually start to write in that I'm leaving the pharmacy. So I can put in 10:25, returning at 10:45, and the time that I was absent, so about 20 minutes. and the reason. Now, the reason is good practice, okay? So you don't have to put the reason in, but it normally helps because then it provides a clear audit and you're not guessing as to why you were absent from the pharmacy, should you be asked. But on this occasion, I am David Williams and I started my job at 9 o'clock. I commenced my responsible pharmacist duties at 9. However, at 10:25, I left. When I returned at 10:45, I then put the 10:45 in, and then I tot it up and say that was 20 minutes, and I was there was a meeting at the general practice, meeting with the GP at the GP practice, okay? So in terms of the role, okay, in terms of thinking about absence, so the responsible pharmacist may be absent for up to a maximum period of 2 hours during the pharmacy business, okay? Now, when the pharmacy business is open, the responsible pharmacist can leave, okay, but they have to make a note of it as indicated in the previous slide. But what you have to remember is that the 2 hours run from midnight to midnight. So if you have a pharmacist absent, you have to remember that it's running from midnight as part of the 2 hours of allocation. Now, when they're absent for those 2 hours, only certain activities can be carried out in the absence of a pharmacist, and that's really crucial. So a pharmacist can leave, but if they leave, then they are absent, so there is a lack of presence, so therefore they are not able to supervise, and that's something we spoke about earlier. Now, with the lack of supervision and essentially their absence, only certain activities can happen. So in terms of an absent pharmacist for 20 minutes, so if we use the example where I've gone to the GP practice to have a meeting, what do you think would be legally permitted in my absence? So do you reckon you can sell over-the-counter medicines? So we're talking about things like day nurse and night nurse. Do you think you can sell medicines from the main shop? So that could be the shop counters on the main shop floor. And do you reckon you can do a legal check of a prescription? So in terms of what can be legally carried out, only selling medicines from the main shop. So everything else has to stop. So you can't sell anything off the main counters, and you can't legally check a prescription unless there's another pharmacist present. Selling medicines from the main shop and the shop floor, that is fine. Okay, they are smaller packets which would be permitted. So let's think about the pharmacy counter. So Mr. Jones hands his medication, comes to the medication counter, and he's greeted by the medicines counter assistant at the pharmacy counter, where he can hand over his prescription. Now, in terms of the prescription journey, if we're thinking about that journey, most of the time, and this is the key thing, is most of the time, it's not always, it's most of the time, the prescription is booked in or checked in some capacity by the medicines counter assistant or the dispensary assistant. And what we mean by booked in or checked in is that the prescription joins the journey through the dispensing system or the dispensary team, and so it's basically taken in and the patient is then given some sort of indication as to whether they're going to have to wait for it, or they're calling back for it, or whether the item needs to be ordered, etc. But in some respect, the prescription is handed over, and then the team now have it ready to prepare for the patient. Now, the next bit would be to get the pharmacist to clinically validate the prescription. So what that means is to check the prescription is legally and clinically valid, that it's safe to dispense, and that there are no errors or any issues with the prescription which require intervention by their prescriber. Okay. Thereafter, the prescription would then be labelled on the patient medication record, and that can be done by someone like the dispensary assistant. It could be the pharmacy technicians, it could be the pharmacist, but normally there's a dispensary assistant who would help with the labelling of the prescription. The medication then can be dispensed by a pharmacy technician or a dispensary assistant, and even pharmacists can dispense medicines. So when I'm working as a locum pharmacist, sometimes it's just me. I have to clinically and legally and clinically validate the prescription. I will then label the prescription and the items, and then I will go ahead and dispense that medication. And then finally, the final step in that prescription journey is the accuracy check. So what we try to do is to have various different people as part of the prescription journey, so it breaks up and removes the element of error. Sometimes you end up reading what you want to read, and so you read something and then you'll pick the wrong drug and you'll label the wrong drug and you'll check the wrong drug. So to sort of minimize this, we have various different assistants or technicians and team members who can help us and assist us with the preparation of the prescription. The medication is essentially accuracy checked. Now, if the prescription was clinically validated, as we mentioned in bullet point number 2, by a pharmacist, then the accuracy check can actually be conducted by the accuracy checking technician. If it's not clinically validated earlier on, then the accuracy checking technician cannot clinically accuracy check that prescription. It would have to be left for the pharmacist. So that's why if you have an ACT, an accuracy checking technician working in your team, it's normally useful to have a pharmacist clinically validate the prescription, because then they are placed to accuracy check that prescription. So let's talk about the dispensary. So in terms of the dispensary, this is essentially where the medication is stored. Now, most pharmacies will have their dispensary laid out in pretty much a similar fashion. So the medications are separated on shelves, and they're normally laid out A to Z by generic drug name. They then have, some pharmacies will have the ear, eye, nose drops all embedded within that A to Z. However, in most cases, most pharmacies will try and segregate the ear, eye and nose drops because they tend to be smaller bottles and smaller boxes, and they can sometimes get lost. Equally, you can have all of the rest of these either embedded within the A to Z or have separate sections. But sometimes things like creams, inhalers, injections, suppositories and pessaries, etc., liquids will all have their own individual sections, because it makes it easier to just go to the right section and pick the right drug. But essentially, what you're thinking about is how the dispensary is laid out. So, for example, you will normally find the oral preparations like liquids and antibiotics almost closer to the fridge, to near the sink, and things like the controlled drugs cabinet will be located somewhere and situated within the pharmacy, but they tend to be further towards the back of the dispensary. Okay, they're not really close to the front. Now, what is a controlled drugs cabinet? Now, controlled drugs cabinet contains controlled drugs which are subject to safe custody requirements. So examples of these include things like morphine, oxycodone, fentanyl. The keys to the cabinet should be in the possession of the pharmacist at all times. So the minute the pharmacy is opened and it's ready to serve customers, the keys for the controlled drugs cabinet need to be in the possession of the pharmacist. There is also a fridge. So the fridge contains medicines which require temperature control. Products in here include examples such as eye drops, ear drops, insulin, vaccines. So for example, the flu vaccine or insulin will be stored in the fridge. Now, in terms of limits, so for a fridge temperature in the pharmacy, the limits are between 2 degrees and 8 degrees. And most pharmacies will check the temperatures of their fridges twice a day. Obviously, if the fridge temperature goes below 2 or above 8, then there are protocols in place to support the management of those products. And there are kind of protocols that need to be followed to check the integrity of the products to make sure that they've not become, unusable. So let's talk about Mr. Jones again. So he has his prescription, it's all been checked and bagged, and it's ready to hand out. However, the pharmacist now has popped out for another meeting at the GP practice. So do we think that the prescription can be handed out to Mr. Jones by the pharmacy team? Do you think yes or no? Have a think. Think about the responsible pharmacist guidelines. Can a prescription for Mr. Jones be handed out if the pharmacist has left the pharmacy? You're thinking about your absence, you're thinking about the supervision and intervention possibilities of the pharmacist. So no, the medication can't be handed out to the patient. So from the Medicines Act, the supply of prescription-only medicines, e.g. handing dispensed medications to a patient or a delivery person, states that you cannot give this out because there's no supervision. So in this case, supervision in the context requires your physical presence, and a pharmacist is not able to advise and intervene in this case because he's gone to a GP practice for a meeting. So what this means is that the patient would now have to wait for the pharmacist to return before they're able to obtain their medication. So let's talk about the pharmacy consultation area. So the consultation area allows for a discrete consultation. So all pharmacies must have a consultation room, and it allows for not only a consultation with a patient about their health or their medication, but also allows for the provision of clinical services. So you can conduct things like medication reviews, you can think about you're doing health checks in these rooms, and also providing vaccinations. So many pharmacies provide the flu vaccination service. They also provide travel vaccinations, and all of these are conducted within the consultation room. In terms of additional income, so there's only a pharmacist will only get paid 90 pence per dispensed item. Okay, so pharmacists and pharmacies are always thinking about how they can increase their income. Obviously, there's the provision of providing advanced or enhanced services. And then there's also the alternate non-pharmacy services. So quite a few pharmacies will provide photography booths and perfumes, and also do body piercing and things like that, just so that increases the revenue within the pharmacy. In terms of pharmacies, okay, obviously there are different types of pharmacies. So an independent pharmacy is one small pharmacy shop, and obviously if they're not very busy, or if they have a quiet period, that can affect their profits. That can really affect how it looks after its staff, and it can in some cases make you almost go bust. Now when you have small or large multiples, so we're thinking like your Day Lewis or your Boots, well actually those pharmacies or pharmacy chains tend to have like area managers or regional managers, and they have divisions, and those divisions etc. Are able to support the sort of less so the pharmacies that aren't doing as well. So if you have a small little pharmacy in a village, that's a Boots for example, and it's not really making much money but it's still serving its purpose, then overall it will have its own targets etc. However, some of the big stores, because they make profit overall, it can help levy the other stores. Now when you're thinking about superstores, so we're thinking about supermarkets, so you've got your Tesco, your Sainsbury's, Morrison's etc. They have departments, so they have a produce department, bakery, pharmacy, alcohol, etc etc. And in the case of pharmacy, if that pharmacy isn't doing well, they only need to have a really busy Christmas or a busy period, which would allow for the profits of the store to balance out or even out the shortfall from the pharmacy department. So if the pharmacy has not had a poor month, the other departments can sometimes rally together and essentially ensure that the store overall produces profit. So there are multiple different sort of business models going on, and I guess it's just something that we need to be mindful of. So going further, so what else is happening in the future? So there's obviously the further extension of electronic prescription service. So a lot of you may have worked in pharmacy and will know that the majority of prescriptions are now electronic, removing the green prescription but actually having an electric or a dispensing token. The fact that we now have internet pharmacies, pharmacy to you, etc. We also have self-selection of P medication that might be coming in. We have summary care records and access to patient details. There are alterations in dispensing, so we're thinking about whether a robot in a pharmacy can replace the pharmacy dispensing team, and you also have centralized hubs or warehouses where you can send prescriptions and it's all dispensed and sent back, so you almost remove the whole dispensing process altogether. And then we're looking at further clinical services as the needs of the sort of the area or the region changes. In terms of what we've looked at today, so obviously we've discussed the regulatory framework. We've had a look at who can own a pharmacy. We've also had a whistle-stop tour of the structure and function of a pharmacy contract. And then we've described the journey of a prescription through the community pharmacy and thought about the future of community pharmacy. Thank you.